received awards. I really appreciated, I could hear Val Burrows as he passed by to come up and get his award, and he said, "What just happened?" We have to, for this affair, really salute Mulva Beverly and her team. This was, I had a view. I had sort of a semi-distant view of what Mulva was accomplishing, along with her very effective committee. And a lot of it had to do with identifying you folks and finding you. And they did a magnificent job. It's not true, by the way, that the CIA has offered Mulva a position with the agency. I heard a story a couple of days ago in the quest for finding one of our lost residents. And we thought he had been found in Phoenix, Arizona. So he got a call, I guess it was from Mulva, and Mulva went through some details with him, and he said, "Oh, no, that wasn't me, I'm sorry." And he said, "What hospital is having the reunion, and where was I supposed to be?" She said, "Harlem Hospital." He said, "Well, okay, well, if you don't find him, call me back and I'll come." He may be here. If he is, welcome. Well, it's really good to see you all, and to see that you really haven't changed very much. You're still the same wonderful people that we worked with many years ago, and you're all recognizable. We had a big discussion with Mulva about having name tags, and she said, "We don't need any name tags." I said, "Mulva, you know, it's 30 or 40 years. You better get some tags out there." But she was right. You all have not changed one bit. And I really appreciated going around this evening and talking with you, looking at your faces, and you're looking back at me, and I could just hear you saying, "Gosh, he looks really good." I think this is the 4th or 5th reunion of former House staff from the Department of Medicine in Harlem. I don't really know why that is, but I have some thoughts. You know, as we go through life, more often than not, we really don't realize and recognize the significance of people, places, and events. We're always sort of thinking ahead, what's coming over the horizon. Is that what I'm made for, what I'm supposed to do? And you don't think about what's going on at the time until later in life, when you're able to look back across the broad arc of your life's experiences, and you can see the significance of the people, the places, what happened, against the background of your life's experiences, and sometimes even against the background of history itself. Now, I don't know what made the Assembly of House Staff so special here, emphasized by the reunions that keep coming. Something special about being a House officer at Harlem Hospital. Certainly some of that had to do with your first experiences as being a physician. And you had a unique background, I think, in understanding the role of human rights in delivery of health care. It was that time that era, that post-civil rights era. And you were able to come to a hospital in the center, in the maelstrom of all of those issues, in a community with extraordinary health status deficiencies, in a community that understood its resources and would fight avidly to support its resources. But that was only part of it. You came to Harlem Hospital. You came to a public general hospital. And public general hospitals had a very low priority standing in the eyes of the public. Priority standing after police, fire services, the need to insist on educational facilities in the community. In one survey, even sanitation services were listed higher, at a higher priority for the public in New York City in comparison to public hospitals. We had 22 public hospitals in New York City then. At that time, most cities had one, Grady Memorial in Atlanta, Boston City, one in St. Louis, Philadelphia General. We had 22. And seething politics surrounding the funding, budget, and management of those hospitals. Some were favored. Some were the prime teaching hospitals for their medical schools, like Bellevue. They didn't have any trouble getting resources. Bronx Municipal, same. Harlem was not the teaching hospital for any medical school. In order to save those hospitals, because they lacked staff and whatnot, particularly after World War II, the city was thoughtful enough to set up a program to link all of the public general hospitals with either an eminent voluntary hospital or a medical school. And Columbia left its medical service at Bellevue, where it had been a prime medical service in this United States, established actually in the 18th century at Bellevue. And they moved it lock, stock, and barrel to Harlem Hospital as evidence of the commitment of Columbia University. And that commitment was clear, it was demanding, it was unswerving. There wouldn't be just medical services at Harlem. There would be a full-scale, full-fledged Department of Medicine with all subspecialties, consummate student teaching, all accredited fellowship and residency programs. It would stand in staffing and excellence in care with the best medical service that anyone could provide. And Columbia did that job as an advocate. In order to do that, they moved the whole medical service up here from 70 beds at Bellevue to 230 beds here. The day before they got to Harlem Hospital, the 230-bed medical service here had 2 medical residents. They needed to have 120. Who took care of those patients before Columbia got here and moved their medical service here? The community physicians took care of the patients. The George Branches, Cecil Marquez, all the community physicians would come in on their own time and take care of these very, very sick patients. They were, in fact, the original hospitalists without resources, with only commitment and love for these patients and for this community. In order to get things started here, the first residents came from Bellevue. They had matched at Bellevue, expected to do their residencies at Bellevue, and Dr. Charles Reagan, who headed the department when it moved here, asked for volunteers. They all came. And they recruited other residents to join them. There could never have been the transformation of the Department of Medicine at Harlem Hospital had it not been for that first group of residents. Were they special? Well, they were. They were serious advocates, activistic advocates, Their devotion to the care of patients was unswerving. The community loved them. They had a reunion last November, just like this. They just wanted to get together and talk about the experience because they felt it was special. 180 of those residents returned and sat about, just as you are, talking about Harlem, what they experienced here at Harlem. A couple of them are here tonight. Peter Schrag was here. I think he just left. He was one of the leaders of the resident group here, and there are a few others here as well. You now, you followed that group, and you found here extraordinary challenges that you faced with convictions that were just emerging as concepts in delivery of medical care. Your time here as a resident coincided with the development of professionalism, the concept of patients first before anything else. Individual patient, groups, communities first in healthcare. And that concept you had immediately as you arrived here with instinct, without having anybody tell you what it was. You felt that the patient came first. You did a lot that you weren't supposed to do, bagging patients in the middle of the night, moving patients back and forward, serving as messengers. You know what I'm talking about. You did what you did because the patient needed to have it done. The hospital didn't have the resources to provide in support of you, but you did it. At that time, another concept that was very popular, since there was so much disparity in healthcare, was the premise that a physician should not serve to provide care for patients in settings where there was inadequate support for the physician's service. We all felt, as you did, that that was nonsense. The physician must care for patients in those settings, but it must not, he or she must not do it quietly. Thus the concept not only of advocacy, joined with patient care, teaching, research, well, the fourth leg of that stool had to be advocacy. And that was obvious at Harlem Hospital. It's obvious everywhere, but it was particularly obvious here. There was a great deal not only of advocacy here among the house staff, but of activism. The Committee of Interns and Residents was sort of a sleepy organization of all of the house staff in the public hospitals before 1969 or so. It was the house staff at Harlem Hospital, no other hospital in the city system, with their burning activism, not only here at Harlem, but throughout the healthcare system. Human rights and the right to health care. From the group of house staff here in this department, there were activistic advocates that made the CIR the active organization to be reckoned with. Mary Bassett was part of that. Big-time troublemaker. And they took the CIR seriously, and one of them emerged as a consummate leader of all of the house staff in the public hospital system and became the executive director when he finished his residency here, the longtime effective executive director of the CIR, Jonathan House. And there were other acts of activism that became so routine. They used to have rallies out here on the corner of Lenox and 135th. You remember? And the community would gather and they'd rail about the latest budget crisis of the closing of a hospital, bullhorns and whatnot. And on one occasion, suddenly the crowd parted. And out from 136th Street came a bunch of house staff, you guys, wheeling beds into the middle of 135th and Lenox, grabbing a bullhorn and explaining why those beds were empty, on and on and on. So the house staff here got to be board eligible with a CAQ, Certificate of Added Qualifications in Bullhorns. When triage by nurses in the emergency room became not only state-of-the-art, but absolutely necessary as a process in the proper care in the emergency room. Hospital couldn't do it, couldn't convince them to do it. No nurses available to do that. Couldn't get funds to build a booth. And that went on and on. One day, some newspaper reporters showed up, and then after them, a van pulled up with some panels and stuff, and they brought it in, and out of nowhere, some artisan house staff appeared and began to build a triage booth in the emergency room. At another level, we were struck with the level of poor health status in the community. We had the highest death rates in every category, from prematures to neonates, infants, up and down the categories, of any health district in the city of New York. And many public health experts said that they were the highest indices of poor health status of any health district in the country. Those data came from the New York City Department of Health. They were publicized in the New York Times. They were recognized by President Carter and our Congressman Charles Rangel. That got us some money, and that was the beginning of the Harlem Primary Care Network, which is now the Renaissance Network. That effort to set up the network with that money also involved residents. A third-year resident who was still in training volunteered and helped put together the patient care program for that network, and that was Linnea Capps. You're one of your awardees. We began to understand that most of the disease that we were seeing and the fights that we had trying to take care of patients had to do with the poor health status of people in our community. And we put together a plan, a broad plan, to set up a prevention program in the Department of Medicine that would deal with the prevention of risk factors that produce disease in the community, dealing with heat stroke, hypothermia, up and down the line. The city folks heard about it, and I was called to a meeting and told Dr. Thompson, you just don't get it. You don't understand. We don't get reimbursed for preventing disease. We get reimbursed for treating disease. Well, it was true, yes. In addition to that, when CAT scans, another example, when CAT scans were judged to be absolutely essential for the care of patient. You should not be running a hospital unless you had a CAT scan. Harlem Hospital did not have a CAT scan. Almost every hospital in New York had CAT scans. And we were assigned in a system so that St. Luke's would give us 2 CAT scans a week, and Bronx Municipal would allow us to have 1 CAT scan when they had the space. The house staff were incensed, the attendings were outraged, the community was up in arms. One of our attendings stepped back from all the rhetoric and sat down to write. And he described the situation and cataloged the 67 deaths that he thought occurred because of a lack of CAT scan. And it was published in the New England Journal. And we had a CAT scan within 2 months of that publication. Those are evidences of activism and advocacy so necessary. And they sort of bridge the situation that is occurring today, unfortunately. The efforts to do away with the Affordable Care Act are, in my view, criminal efforts. If one understands the Affordable Care Act and its mission, which is to reduce primarily the number of uninsured people in this country. What is not understood, or what is denied by the enemies of this kind of legislation, is that being uninsured in this country has serious medical consequences. The National Academy of Medicine, which serves as the nation's advisor on health matters, it is the nation's advisor. It usually gives advice after having a distinguished panel review a subject. The National Academy of Medicine reviewed the uninsured 7 times, issued 7 reports, and stated concisely and pointedly that the President and the Congress should move quickly to establish coverage, health insurance coverage for everyone in this country, and also find a way to pay for it. The Affordable Care Act reduced the number of uninsured by 20 million people in 1 year. And if you understand that not having insurance is like having another disease, another deadly disease, that was a significant achievement of the Affordable Care Act that bore directly on the well-being and health of the nation's people. And if the Affordable Care Act continues, it will lower the number of uninsured to a very low level by 2026. We should know and recognize that those who cried for repeal of the Affordable Care Act passed a bill in the House of Representatives that would have increased the number of uninsured. There was no discussion, there were no hearings, there was no debate, it was just done. They also, if that bill stood, would drastically change Medicaid, which has become a prime source of health insurance for the nation. There are more people on Medicaid getting both health insurance and a whole bevy of services than there are on Medicare. They would increase the number of uninsured and also set up systems that would weaken Medicaid. You're hearing this today by providing block grants to the states. In other words, here's a block of money. Don't worry us to death about giving you any more money for Medicaid. You take care of it. And they also would allow the states to waive the federally required scope of services to be provided for Medicaid. These are terribly destructive suggestions or actions that would be taken if that bill came into fruition for many, many people, not only people insured by other than Medicaid, but certainly for those under Medicaid. So I have a feeling about this reunion. And one of the observations is there's no way that the most devoted, skilled, accomplished physicians like you can provide proper health care for everybody in this country without enabling legislation. It just can't happen. You see that now. You also see the lengths to which they will go to prevent proper health insurance coverage, even in the face of serious medical consequences. No principles whatsoever. I do think it's time that we expect from elected and appointed officials, particularly from our elected officials, that we expect from them the same higher calling when they deal with decisions regarding health care and the health and well-being of the people. A higher calling than the political nonsense that we have to witness going on now. I didn't really want this to be a meeting about me. I really didn't want that. I profoundly appreciate it. This was a very, very touching dinner, and to see all of you and hear the remarks. I can't tell you how touched I was, particularly by the two chief residents. I thought this meeting should be about you. I recognize the significance, I think I did, of each one of you who were here with us in those years. And I think I recognized it against the background of history. And I know it is much more intense, that recognition today, by what has happened over the years. I do think there is reason to consider staying together. I don't mean necessarily formally organizing, but staying in touch with each other. This is really a family. There's so much I'm sure you want to know about each other, and you still have the same common feelings of principles, human rights, justice in medicine that you had when you were here, and that was strengthened by each of you. I think it would be wonderful if you stayed in touch, and you, as a family, and you learned about each other, what you've done since those days, and you compared notes on what's happening in these days. I thank you very much. I am deeply grateful and really quite touched by these last 2 days. And I really cherish seeing all of you. I just wish I had more time with each one of you. I hope that somehow happens. Thank you very much. Thank you.